Welcome to our channel Nanjil Nurse. Hope you are all fine. In today's video, we will be seeing about the most important topic in medical surgical nursing too, which is the cranial nerves. Most of the students will be finding difficulty in memorizing the names of the cranial nerves. Some of you may have doubts about the different functions of the cranial nerves, and some of you will be having doubts about the different parts of the body which are supplied by the cranial nerves. So, in today's video, I will try to give you a clear idea about the cranial nerves, and at the end of the class, I will be giving you an easy mnemonic which will be helpful for you to memorize the names of the cranial nerves easily. So, let us go into the video. Let us see about the cranial nerves. Cranial nerves are a part of the nervous system. They are the nerves that emerge directly from the brain and the brainstem. There are about 12 pairs of cranial nerves which are described with Roman numerals. The numbering of the cranial nerves is based on the order in which they emerge from the brain and the brainstem from front to back. That is, the cranial nerve which first emerge from the brain will be given first Roman letter, and then the remaining cranial nerves will be given successive numbers. The cranial nerves come out of the skull through the small holes in the skull called foramen, and then they travel to their destinations. The purpose of the cranial nerve is to relay information between the brain and different parts of the body where they supply. Now, let us see about the names of the 12 pairs of cranial nerves with the help of the diagram shown here. The first nerve is olfactory nerve, which emerges from the cerebrum. The second nerve is optic nerve, which also emerges from the cerebrum. So, these two nerves, that is the olfactory nerve and the optic nerve, emerge from the cerebrum, and the remaining 10 pairs of the cranial nerves emerge from the brainstem. So, the third cranial nerve is the oculomotor nerve. The fourth nerve is the trochlear nerve. The fifth nerve is the trigeminal nerve, where we have 3 branches. The sixth nerve is the abducens nerve. The seventh nerve is the facial nerve. The eighth nerve is the vestibulo-cochlear nerve, where we have 2 branches. The ninth nerve is glossopharyngeal nerve. The 10th nerve is vagus nerve. The 11th nerve is accessory nerve, and the 12th nerve is hypoglossal nerve. Now, let us see about each pair of cranial nerves in detail. The first cranial nerve is the olfactory nerve. Olfactory means sense of smell. So, olfactory nerve conveys information to the nose, and it gives rise to the sense of smell. If there is any damage to the olfactory nerve, it may cause inability to smell or a distortion in the sense of smell. The second nerve is optic nerve. Optic refers to eye. So, the optic nerve conveys information to the eye, and it gives rise to the sense of vision. If there is any damage to the optic nerve, it may lead to partial or complete loss of vision, and these two nerves, that is the olfactory nerve and the optic nerve, emerge from the cerebrum, and these two nerves are called sensory nerves because they deal with the sense of smell and the sense of vision. Now, let us see the next 3 pairs of cranial nerves together, that is the third cranial nerve oculomotor nerve, the fourth cranial nerve trochlear nerve, and the sixth cranial nerve abducens nerve. Because these 3 pairs of cranial nerves are responsible for the coordination of the movement of the eyeball. There are 6 muscles which coordinates the movement of the eyeball, that is the superior rectus muscle, inferior rectus muscle, medial rectus muscle, inferior oblique muscle, which are supplied by the third cranial nerve, that is the oculomotor nerve, and the superior oblique muscle is supplied by the fourth cranial nerve, that is the trochlear nerve, and the lateral rectus muscle is supplied by the sixth cranial nerve, that is the abducens nerve. If there is any damage to any one of these pairs of cranial nerves, then it may lead to problems like strabismus and double vision, because there will be inability to coordinate the movements of the eyeball. Now, let us see about the fifth cranial nerve, that is the trigeminal nerve. As the name indicates, it has 3 branches. This trigeminal nerve is responsible for the sensation of facial skin, and also it controls the movement of the muscles of chewing. It has three branches. The first one is ophthalmic nerve, second one is maxillary nerve, and the third one is mandibular nerve. The ophthalmic nerve is responsible for the sensation and movement of the upper one-third of the face. The maxillary nerve is responsible for the sensation and movement of the middle one-third of the face. And the third one, the mandibular nerve, is responsible for the sensation and movement of the lower one-third of the face. Next, we are going to see about the seventh cranial nerve, which is the facial nerve. The facial nerve is responsible for the control of muscles of facial expression, and it is responsible for the sense of taste from the front two-thirds of the tongue, and it supplies the stapedius muscle which supports the stapes bone in the middle ear. If there is any damage of the facial nerve, it may cause facial palsy, a condition which is characterized by inability to move muscles on one or both sides of the face. Next is the eighth cranial nerve, the vestibulo-cochlear nerve. As I have said earlier, vestibulo-cochlear nerve has two branches. The first is the vestibular nerve and the second one is the cochlear nerve. Vestibular nerve supplies the vestibule, that is a portion of the inner ear which is responsible for maintaining equilibrium in the body, or it is responsible for maintaining postural balance in our body. And the cochlear nerve supplies cochlea, which is another portion in the inner ear, that is an important organ in the ear. It is otherwise called as organ of hearing. So cochlear nerve supplies the cochlea, which is responsible for hearing. If there is any damage to the vestibulo-cochlear nerve, there will be disturbances in maintaining equilibrium of the body. You will have dizziness and vertigo, and also there will be problem in hearing. There may be partial or complete loss of hearing. Next, we will see about the ninth cranial nerve, the glossopharyngeal nerve. Glosso means tongue and pharyngeal means oropharynx. So, glossopharyngeal nerve is responsible for the sensation of oropharynx and back of the tongue. So, if there is any problem in glossopharyngeal nerve, it will lead to loss of gag reflex. And the next one is vagus nerve. The vagus nerve is responsible for the sensation and parasympathetic supply of the structures of the neck and most of the organs in the chest and the abdomen. If there is any problem in the vagus nerve, it will lead to loss of parasympathetic supply. Sympathetic supply will lead to fight or flight response. Parasympathetic supply will restore your body in a calm state. So, when vagus nerve is damaged, it will lead to loss of parasympathetic supply. For example, if parasympathetic supply of the heart is stopped, it will lead to increased blood pressure and increased heart rate. Next, we will see about the 11th cranial nerve, which is the accessory nerve. Accessory nerve supplies the sternocleidomastoid muscle and the trapezius muscle. Sternocleidomastoid muscle connects the sternum, clavicle and the mastoid process of the temporal bone. It is responsible for turning and nodding of the neck. The trapezius muscle extends over the back of the head and the shoulder. It is responsible for turning of the head and elevation of the shoulder. If there is any problem with the accessory nerve, it will lead to problems in turning and nodding of the neck, and the elevation problem, there will be problem in elevation of the shoulders, and the shoulder blade, that is the scapula, is relaxed and it will be in a winged position. Next is the 12th cranial nerve, the hypoglossal nerve. Hypoglossal nerve is responsible for the movement of the muscles of the tongue. If there is any problem with the hypoglossal nerve, it will lead to inability to move the muscles of the tongue. Now, let us see a mnemonic which will be helpful for you to remember the names of the cranial nerves easily. This mnemonic is taught to me by one of our teachers. So, even today I can remember the names of the cranial nerves easily. The mnemonic is like this. One of our Tamil teachers asked for very good vada and halwa. You can take the first letter of each word. O stands for olfactory nerve, O stands for optic nerve, O stands for oculomotor nerve, T stands for trochlear nerve, T stands for trigeminal nerve, A stands for abducens nerve, F stands for facial nerve, V stands for vestibulocochlear nerve, G stands for glossopharyngeal nerve, V stands for vagus nerve, A stands for accessory nerve, and H stands for hypoglossal nerve. So if you remember this mnemonic, it will be easy for you to remember the names of the cranial nerves. Now there is another mnemonic which will be useful for you to identify whether the nerve is a sensory nerve or motor nerve or both. So here is the mnemonic. Some says money matters, but my brother says big books matter most. So here also you have to take the first letter of each word. Here there are letters like S, M and B. So S stands for sensory nerve, M stands for motor nerve and B stands for both, that is sensory as well as motor. So olfactory nerve is a sensory nerve, optic nerve is a sensory nerve, oculomotor nerve is a motor nerve, trochlear nerve is a motor nerve, trigeminal nerve is both sensory and motor. Abducens nerve is a motor nerve, facial nerve is both sensory and motor. Vestibulocochlear nerve is a sensory nerve, glossopharyngeal nerve is both sensory and motor, vagus nerve is both sensory and motor, accessory nerve is a motor nerve, hypoglossal nerve is a motor nerve. I am sure that this video could have given you a clear idea about the cranial nerves and how to memorize the names of the cranial nerves very easily, and also how to identify the cranial nerves, whether it is a motor nerve or a sensory nerve or both. If this video is useful to you, kindly like the video, comment and share the video. If you are new to our channel, kindly subscribe our channel and don't forget to press the bell button to get the notifications. Thank you. Have a great day.